Okay, so our first speaker, we're really fortunate to have here today for opening remarks our CEO, Dr. Kevin Smith. Kevin is the president and COO of the University Health Network, Canada's largest academic health sciences centre. Kevin spent his career at the interface of university and research hospital and is passionately committed to the mission of the education, research, and exemplary clinical care. Dr. Smith is a pioneer in advancing integrated care models spanning the continuum of health and social services. How do we disrupt the traditional paradigm of care delivery? Kevin's always challenging us. He's a professor in IMS and IHPME here at the University of Toronto, Rotman School of Management, and the DeGroote School of Medicine, Department of Medicine at the McMaster University. Kevin was educated in Canada, the United States, and Great Britain, started in the domain of medical education. I'm making him uncomfortable now talking about him so long. He wants me to hurry up, David. And he also has other roles. He serves as the chair of the Council of Academic Health Hospitals of Ontario and has supported research in many domains, including working as a chair of the Canadian Foundation for Innovation, which funds a lot of the infrastructure we have within the research community across Canada. So, Dr. Kevin Smith.
I didn't wear my pioneer hat, but I tied up my horse at the front door. Thank you very much, and like David, I want to recognize the investment of our sponsors and the founding foundations. The Princess Margaret Foundation, Baxter in today's sponsorship, the Fidanis, the Garans, and our gold mining friends. So thank you very much for making that investment. I also want to really acknowledge and compliment you on focusing on enabling AI. I think up to date we've had some really great discussions about AI, and now we see people chomping at the bit to say, very interesting, but what does that mean for me? And I see Heather Ross is here, no one more passionate about trying to make that happen in heart disease, and I know that the room is filled with other colleagues who are asking the exact same thing in their clinical domains, be it in illness care, prevention, promotion, or the interface of health and social services. So we're obviously very, very fortunate to have one of the highest concentrations of AI talent in the world, much of it in this room today, certainly in this city. The World Economic Forum ranked Canada 4th on its global list of availability of quality scientists and engineers, and that's something we should be very proud of, but also guard carefully, as we know brain drains and brain gains can turn around quickly. I have to say that UHN and Tecna are incredibly proud to be both part of that ecosystem and hopefully in some small way driving it. And I think we all agree that we have an extremely exciting potential in our future, as demonstrated by the large tech companies selecting Toronto. I think one of the most important parts of the day is demonstrating the partnership that we enjoy with the Vector Institute and the importance of co-recruitment. Recruiting scientists in rehab, cardiac cancer, and of course the basic sciences of artificial intelligence. And in my view, there's a huge opportunity by combining the brightest and best minds in the technology computing world with the brightest and best minds in the clinical world, and impressing both of those with remarkable hospital data systems, not only from one institution, but from across the Toronto Academic Health Science Centre ecosystem, which is just maybe a point of pause for me, and that is to talk for a moment about Team Toronto. And the fact that when you look at Toronto and the academic enterprise, and you put us all together, we are third in North America, only to the UCFS group and the Harvard group in bringing this initiative together. And making Toronto an easy place to do business and scholarship for AI is a challenge I think we all want to embrace. That it's difficult. We often hear from industry, when I get to Toronto, I see all this comedy of riches, but when I try to navigate it and work with all of the players, it's increasingly difficult. So for us, in our emerging strategic plan, that is a theme. Simplify how you can work with us collectively, the TASIN network, the CAHO network, and the expanded network of colleagues who collectively can improve AI. So as we look at big data, we're drowning in data perhaps and thirsting for information, as we often hear, or I sometimes feel that way. So perhaps there's two parts to that solution, and you're going to talk about it today, I think. Better data governance. So how do we get at this if we wish AI to reach its full potential here? And frankly, that alone could and should make Toronto famous. That as this world emerges, how does one govern this data? Every day in the media, we're hearing the challenge of who owns my data, how will it be ethically protected, how can I ensure that data on me is being used for things that I agree with and that I've consented to. And again, Toronto has a great history, and Ontario has a great history of embracing this approach. This will be a big step, I think, in helping us mature as an organization and being a world destination for investment. So I compliment you on the work that's been done, and I'm sure the work that will be done. The second and perhaps most important ingredient is empowering our staff, most importantly, those who do frontline work. Particularly in healthcare, the frontline is feeling challenging. Few people that I know on the front line feel as though the good days are just around the corner, the money's going to start flowing in, patients are going to become lighter, demands are going to be less. It's not feeling like these solutions are all at hand. So that being the case, we really need to ask the question, how will technology help build resilience in a laboring workforce and challenging times with an aging population and lots of comorbidities? That also means that our patients have to be engaged in that process, and those we have the privilege of serving. That will accelerate our research efforts widely. It will also save us on costs. A number of studies have recognized that the quote-unquote activated patient, the engaged patient, is a 20% less costly patient when they're engaged in deciding what they wish and how they wish it delivered, and frankly, what perhaps we offer them that they don't really want or need. So if we maximize our use of data, I believe that may help us in making some of those very, very difficult decisions. One of the very important initiatives of AI clearly is economic growth. And as we look to the federal government for investment, the big question is long-term economic diversification, particularly in highly qualified personnel. So there's a lot for you to discuss on how Canada can and should be a destination, right from the basic science of AI through to the policy questions of commercialization and economies related to artificial intelligence. I hope you have a great day ahead of you. I know that there's a debate going on about whether we're ready for AI in healthcare. I guess it's gone down, but I didn't see the final poll. It looked like a 60-40 a few minutes ago. I don't know if it'll stay that way. But if it is, in my view, that's a healthy ecosystem. A group of people ready to charge forward with enthusiasm and a group of people saying, whoa, 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 just as we do, perhaps we need to make sure we've got all the... I hope you'll also think a little bit more about that patient engagement piece. Today in your discussions, how does the consumer have a loud voice? And in closing, let me particularly call out my colleague, David Jaffrey, who has been the intellectual steward behind Tecna, not to mention the person who the donors have fallen in love with, which is very important. So David, I want to thank you for your driving leadership. One of the great pleasures of coming to UHN has been working with a big brain like David, so thank you for your leadership in this. Maybe join me in a... Let me also recognize for you the organizing committee, Tracy Liu, Kathy Williams, Allison Paprika, Frank Rudzik, Anna Goldenberg, Michael Caesar, Benjamin Hyde-Keynes, Mira Vignaraja, and of course our own David Jaffrey. So thank you to the team who's put so much work into today. My parting words to you are have a candid, honest, and productive conversation. I don't think that'll be hard because I look around this room with some of the faces. I hope you all leave today inspired and ready to unleash the potential we have and go back to your day job saying, so what did I do today that will change how I behave tomorrow? Thank you very much.